Hey everyone, I promised I was at the Momentum in Medicine conference. I told you I would be bringing some world experts to you right now, and I'm popping in live. I told you to set your alerts. I told you I'd be coming through you too throughout the weekend, so make sure you tune in. I actually have a nationally recognized addiction expert, Dr. Cyntrell Psych, here with us today, and she's going to tell us a little bit more about teens and teens addiction, and that's a topic that you guys asked me to cover on 2 Cents Tuesdays, and it's a Saturday. I'm giving you a 2 Cents Tuesdays bonus with Dr. Cyntrell Psych, so make sure you check her out. For those of you just tuning in, I am Dr. Jarret, your board-certified pediatrician and behavior coach. I am here to help parents who have problem children, giving them difficulty with behavior, recognize and correct that behavior. I'm doing this through my books, my programs that I have forthcoming, and my 2 Cents Tuesdays, of course. So I have that just for you guys, and I'm here for you guys, and we'll get this rolling. So Dr. Cyntrell, could you tell us a little bit about yourself?
Hi, I'm Dr. Cyntrell. I'm a psychiatrist who focuses on addiction and recovery. I help those struggling with addiction find a pathway to recovery through my book, the Urge Fix Recovery Guide, and also through my web series that you can find at Dr. Cyntrell Psych. You can follow me on all social medias at Dr. Cyntrell Psych. That's DrCyntrell Psych, Psych. I look forward to hearing from you guys. Today we're going to talk about teens addiction, and we'll give it back to Dr. Jarret to start the questions. If you guys have any questions, please feel free to just pop it up into the chat, and we'll try to get to it.
Well, thank you, Dr. Cyntrell, for joining us. I mean, this is such a privilege to have you here live and in person, because we know you're out there busy writing books, doing your podcast, you're doing a lot of speaking, you're doing a lot of great things to help fight addiction. And one of my viewers did ask on 2 Cents Tuesdays this season that we actually talk about addiction and trends in addiction with teens. So what kind of things are we seeing in addiction with teens right now?
Well, with teens, so you have to pay attention to teens, and you have to really monitor your children. With teens, you have to think about drug abuse and addiction. So most kids sometimes like to experiment with different things, and sometimes that thing may be drugs. So you would have to have an open conversation with your child, and also realize that maybe it's experimentation now, but later on it will be, there'll be adults, and it actually will just be an addiction and a problem in the future. So teens are kind of interesting in that, they actually will try what they can get their hands on. They're not going to, you're not going to find the kids going to the crack dealer or the cocaine dealer or heroin person on the street unless they have access to them. What I find in teenagers is that they're actually doing inhalants, like the things like snorting the things in your kitchen cabinet or your bathroom under your sink. Also, marijuana is a big thing with teenagers. And if they're going to parties, they may be exposed to ecstasy and LSD. There was this trend on Facebook that maybe there were some kids doing pods, the things that we use in our kitchen, which is very strange, but that is something that was been going on. So the problem with teenagers using drugs of any kind, even alcohol, like sneaking alcohol that maybe mama or daddy have in an icebox, would also be another drug that they would have access to. The problems with teens using alcohol is that their brain is still developing, so they're going to use a lot of cognitive functionings, then they'll have change in behaviors. And actually, there's a lot of studies linking marijuana use to schizophrenia. So with teens, it's very dangerous for them to start using drugs early. And the earlier they use, the more likely that their addiction will follow them through to their adulthood. So if you wanted to know I don't know, I guess I could keep talking, but what's the next question? I get on my soapbox. Sorry, guys.
Well, that's great information, Dr. Cyntrell. In fact, we did a 2 Cents Tuesdays episode on the Tide Pods and the Tide Pod Challenge. I didn't even think I needed to waste airtime on that, but it's just one of those things that, okay, listen to a doctor, they say not to do it. you did pick up on things that are around the household. And another thing I've heard about are...
That's called huffing, sorry. I should have used the terminology that they use as huffing, which actually will really kill their brain cells. Go ahead.
Excellent. So as they're inhaling and doing these huffings, or they're finding things in the medicine cabinet where they may just take some pills and take them to what they call a pill party, where they'll go and put a bunch of pills in the basket and just let kids go around and take them. And that kind of thing is dangerous. So parents, you should keep your medicine cabinets locked up, particularly if you have opioids. So that would be your things like Tylenol 3s, 512s are some of the street names, things with codeine. All of these things, you should keep those
Xanax.
Locked away. Xanax, people are abusing Xanax and turning them into bars. So there's a lot of other things that are there. So go ahead, Dr. Cyntrell.
And also with your kids, you have to be careful with the medication you allow doctors to prescribe. I know a lot of my patients now who are adults, I mostly focus on adults, they actually started using like opiates when they were in childhood. Maybe they had a dental procedure, or they had a sporting accident. So you have to be in control of your child's medication regimen. You have to make sure that they're not using too many. Even if they're in pain, you got to kind of rate it like we do. Like when you're in the hospital, you ask me to say that you're in pain. Well, you're gonna have to tell me if it's a 2, which is not that bad, versus a 7. And I'm not gonna give you 5, 6, 7 pills a day. This is not necessary. And there's other ways to combat pain without taking a pill. So a lot of my patients now in my opioid clinic, my medication management clinic, started using opioids when they had a accident, or a sporting accident, or a dental procedure, and it just got out of hand because they were in control of their medication.
Wow, that's very good information for my followers to understand. And a lot of times people don't prescribe children opioids anymore. I mean, there was routine times when we would use codeine, for instance, as a cough medicine. And that just isn't the case because we understand the addiction. So tell me a little bit about what you can help people with for maybe some parents that are struggling with addiction.
Of themselves.
Yes.
Okay. Well, just know that you are the example to your kids, so you should get treatment. There's a lot of options. There's inpatient rehab, outpatient rehab, or you can call me. Contact me and I can help you. But you also need to realize how much of a struggle that your family is going through if you're using drugs or alcohol or any type of addiction that you might have, pornography, gambling. I mean, any of those things that are overdone can wreak havoc in your family. And that if you love your family and you want your kids to have a good childhood and you leading by example, then you should take care of yourself by treating your addiction, making sure that you're not overdoing anything that will show your kids that, poor coping skills. Like, oh, mommy uses alcohol when she's mad at daddy, or daddy slams the door, hits mommy, and goes off into the night and doesn't return home. And when he does return home, he's intoxicated or he's even yelling more. So just take care of yourself, and so that your kids can function and be functioning adults in the future.
Well, you heard it first from nationally recognized addiction specialist, Dr. Cyntrell. She has been a wonderful guest on the show today, and I wanted to give you guys a little bit extra. And so do you have any final comments that you'd like for the audience today, Dr. Cyntrell?
One final comment I wanted to make is I noticed that some parents when I actually work with children, they're afraid to talk to their children. But, if you're not talking to your children, who's in your child's ear? So if you're afraid to have those conversations, you just have to approach conversations about drugs, alcohol, sex, whatever it is that you're afraid to talk about your children. Just have compassion and just have an open discussion, because if they can't talk to you, then who are they relying on? Who's giving them their advice? So just go to them. Like, we're talking about drugs and alcohol. To ask, have you ever been offered any drugs or alcohol? Have you ever been offered any pills? Or if you're watching TV, that would be an easy way. Do you know anything about this? Like if something comes on TV like beer, have you tried it? Or anything that could just ease the conversation. It won't be so much pressure on either of you guys to answer, or for you to ask and them to answer, to help you and your child have an open discussion. You don't have to have it so formal and so intimidating, and definitely don't be judgmental, because as soon as you lose that, you may have lost it for a lifetime. If they don't feel like they can come to you and talk, like people talk to me all the time, so I know what people say. Oh, they're judging me. Oh, it's so hard to talk to my mom. It's so hard to talk to my dad. Well, who are you talking to? So you got to be the ear for your child.
Wow. That is excellent advice for any parent. We're talking about addiction. We're talking about behavior. Your children are actually going to follow your actions more than anything you say. Have open and frank conversations. Also model the behavior that you want your children to have. Excellent advice, Dr. Cyntrell. Thank you so much for being on 2 Cents Tuesdays on the bonus edition on a Saturday. This is Dr. Cyntrell, and I love it. It's a beautiful day here in Atlanta. We're happy to be here, and we actually were on stage at the Momentum in Medicine conference last night, and I just happened to be talking with her for a little bit and said, we got to give this information to my viewers. Tell us where they can follow you.
So you can follow me on all social media at Dr. Cyntrell Psych. That's DrCyntrell Psych, PCYCH. I look forward to actually having more of these discussions, because teen addiction usually leads them to me as adults. So I definitely think if we can start combating it early, then no one would have to see me. Then I'll be out of a job. Put me out of work. Put me out of work. That's my goal. I want to put me out of work.
Thank you, Dr. Cyntrell. On that note, you guys know who I am. I'm Dr. Jarret, your board-certified pediatrician and parental behavior coach, here to help all parents out there trying to get better health and behavior on their kids, doing this through my books, my 2 Cents Tuesday show, and other online programs I have forthcoming, so look out for them. This won't be the last interview that I have. There's a lot of other great guests here, but make sure you're going to follow Dr. Cyntrell at Dr. Cyntrell Psych. You can see more about her on her website at DoctorCyntrellPsych.com, and we will see you guys very, very soon. Thanks for tuning in.